How do we find vitamin B12 deficiency? There is a simplest way to catch up with vitamin B12 when cobalamin levels are low. Our body sends signals to the face. Nerve pain. Studies have shown that nerve pain may appear on the face when vitamin B12 is insufficient. There are various patterns, but pain is usually felt on only one side of the face. The pain may occur near the cheekbones, just below the eyes, and sharp pain may be felt across the forehead. In severe cases, the pain comes down to the nose. Yellow eye. Jaundice can cause the face to turn yellow, but it can also cause jaundice, which causes yellow eyes. Red blood cells are poorly made due to a lack of vitamin B12. Malignant anemia may occur simultaneously due to a lack of blood cells. Vitamin B acts as a crucial coenzyme in the body. Vitamin B12, as known as cobalamin, is necessary for various bodily functions, like producing red blood cells, proper nerve function, and DNA synthesis. This vitamin B12 deficiency can lead to many health issues, and here are some potential consequences of its deficiency. Anemia. Here comes anemia, definitely. Vitamin B12 is one of the big groups. It is a water-soluble vitamin used in various places such as red blood cell formation, cell metabolism, nerve, and DNA formation. Lack of vitamin B12 results in difficulty in forming normal blood cells due to DNA synthesis disorders, which can lead to anemia. The deficiency of vitamin B12 causes anemia, and it is also called megaloblastic anemia because blood tests characterize abnormally large red blood cells compared to the normal. Symptoms may include fatigue, weakness, pale skin, and shortness of breath. Neurological symptoms: numbness in the hands and feet, difficulty walking and balance, malfunction in the memory and cognitive difficulties. These all are linked to vitamin B12 deficiency, which sometimes cause irreversible nerve damage. Neurological problems could be myelopathy, peripheral, optic, and even dementia. This cobalamin deficiency is widespread in the elderly and after gastric surgery. Gastrointestinal issues. A lack of vitamin B12 can cause loss of appetite, weight loss, constipation, diarrhea, and red tongue. Several small intestine disorders, especially if the lumen is involved, can interfere with cobalamin absorption. These conditions could include IBD, radiation arthritis, lymphoma, and so on. If you are already experiencing these conditions, your vitamin B12 level should be appropriately monitored. Bone health. Vitamin B12 deficiency may be associated with an increased risk of osteoporosis and bone fractures. Pregnancy complications. Pregnant women with B12 deficiency may be at risk of giving birth prematurely or having a baby with low birth weight. This can also affect the neurological development of the fetus. Where is the vitamin B12? The optimal functioning of the central and peripheral nervous system depends on a constant supply of vitamin B12. It is often found in meat such as beef and pork, and dairy like eggs and milk, and salmon. In particular, meat from ruminant and liver are valuable sources of the vitamin B12. Milk and dairy products have slightly lower vitamin B12 amount than meat. If the meat and milk were processed in thermal treatment, severe losses of vitamins are inevitable. However, cooked meat offers similar or even higher B12 portions compared to raw meat. Unlike other water-soluble vitamins, vitamin B12 is stored in a significant amount in the liver, so a lack of intake of food does not immediately lead to deficiency.